Today we're going to talk about the highest absorption method of TRT, testosterone replacement therapy. It's crucial that, with using TRT and everything in life, you get the big picture and make sure you can be having a responsible and informed decision of how to go about it, right? So today what we're going to talk about is basically a few modalities of TRT. We're going to make sure that you can learn about the science behind it, the testosterone delivery systems available today, and overall why injectable testosterone is the most effective. All right, so let's get into it. So really, let's go and try to start educating on all the types of testosterone marketed, right? So the term bioidentical is often misconstrued, even by physicians who often claim that bioidentical testosterone is better or more natural than pharma-grade testosterone. The reality is in between, in that all testosterone utilized in TRT possesses an identical molecular structure to your body's naturally produced testosterone. So pharmaceutical-grade testosterone is bioidentical to natural testosterone because it is an esterized form of testosterone, right? Esterized testosterone means that the testosterone is attached to a carrier molecule known as an ester, and that is kind of basically broken off into the bloodstream, leaving you with identical testosterone molecule that your gonads produce, right? The testicles are produced in men. So while research strongly indicates that our optimal protocol using injectable testosterone is the best delivery method, we do want to cover kind of other delivery systems so you can kind of make an informed decision for yourself. Okay, so oftentimes, doctors prescribe transdermal topicals over injectables because it's easy and it's, doesn't feel any, issue. And a lot of clients and patients have fear of needles. This is okay, but it ultimately kind of boils down to the choice of the patient. Now, there are doctors that believe that topical delivery system, when used in strong, competent concentrations, will work okay. Theories that transdermal delivery systems produce a serum and androgen, so basically a base testosterone profile, which will fluctuate during the day, kind of mimicking normal fluctuations of an endogenous testosterone production in a normal, kind of young, healthy guy. In plain terms, what does it mean? It means basically the randomness in hormone levels best replicates the feelings of being young again. And so it also elevates DHT. The transdermals are kind of better at maybe addressing sexual dysfunction. So transdermals are available in kind of creams, gels, skin patch. There's also kind of intranasal gel, which is taken to the nose, which applies a thin layer of tea into the lining of your nose, right? And so that's something that is a possibility as well. And there's also basically oral medications and intranasal gel. So intranasal takes in once again take it into the nose, and it applies a thin layer of testosterone that absorbs in the lining of your nose. Oral meds, typically dosed twice a day, troches, release testosterone that's absorbed via the lymphatic system. So it kind of bypasses the liver and avoids any potential liver issues, right? And so there are two other methods that are more invasive. So basically the Topical preparations method involves troches, so oral testosterone being absorbed by your gums, and that goes directly into your bloodstream. And so it's known as kind of a complex testosterone sublingual formulation, or a troche, okay? And this form of TRT is rapidly absorbed into the blood circulation, while testosterone is released from the shell, right? And so another opportunity is pellets, right? And these pellets are surgically implanted under the skin near the hip, and they release testosterone over the course of 3 to 6 months. The challenge with these pellets is obviously surgical procedure, and there are things that can occur during a surgery, and it's pretty invasive, right? Because it has to be implanted. And if it's implanted wrong, things can happen, right? So let's look at a kind of side-by-side comparison of all the methods, right? So we kind of walk through this chart to help you understand delivery methods and why we feel, some aren't as strong as others. The benefits really don't outweigh their potential side effects, nor kind of the inefficiencies in preparation for application, right, when compared to injectable testosterone, okay? So transdermal creams, recommended over gels. Testosterone creams are compounded in a base that offers a kind of higher penetration of tests through the skin, 40 to 50% higher than penetration in water in most gels. And so, since 5 times the amount of drug is being delivered into circulation by using a transdermal cream versus gel, a lower amount technically is needed to be applied for optimal levels. Creams also moisten the skin, while alcohol is kind of base gels dry skin out. So another thing about kind of, the gels is they come in either 1 to 2, 5%, 10% concentrations of testosterone. In our opinion, it's not like ideal for a few reasons, right? So the primary drawback is the concentration might be a little too low, and it's difficult to kind of control the delivery of the dosage, right? Absorption through the skin, it's really inefficient. It's based off at people's bodies, our food consumption, our sweat glands, and other factors. And it's really kind of dangerous, or not the best, when you accidentally transfer over the cream to children, okay, or women, or your partner when you come in contact with them. Not so good, right? And it's something also that is available as a skin patch, right? So the patch basically, it can be applied once a night for 24 hours, but the patch has to be removed and a new one is applied. You do have to wait 3 hours after applying the patch before you shower, swim, or kind of do exercise or sweat, right? Because that can loosen the patch and cause it to fall off. This kind of form of TRT ain't the best because it causes some skin irritation, right, at the place of adhesion. There's intranasal gel, as we talked about earlier, and does have some side effects, right? It's not limited, but there are some side effects research studies have shown, increasing the PSA, so prostate-specific antigen levels. Not so good. Headaches, runny nose pain, sore throat, cough, right? And sometimes upper respiratory infections and sinus infections with regard to nasal gel, right? So, some other injections might, side effects include other, higher than normal erections, right? Or erections that last a longer time, right? So, when it comes to oral medications, however, it seems like guys really prefer oral formulation over injections and creams. That's okay in the sense that they would avoid many of the safety issues associated with kind of the accidental transfer of testosterone to women and children that can occur from transdermal testosterone products. Some doctors believe oral TRT can improve patient compliance. So as we talked about earlier, the troches, the buccal, preparations aren't the most efficient method of getting tests in your system, kind of because of its poor bioavailability and absorption in the body, right? So side effects of these are dislodged tablets, kind of bleeding gums, sores, toothaches, and kind of headaches, and that culminates kind of in not the best TRT solution, right? And obviously, if you're kissing somebody or a partner, that can be transferred, not so good, right? So, the last thing is pellets. That is kind of believed to have the longest duration of action. But the pellets, while they do last a long time, it's pretty invasive. You have to have a surgery. It has to be taken in, taken out. If the surgery is placed the wrong way, that can hurt like no other. And there's also a risk of infection and other types of infections being a surgical model, right? Hemorrhage also. And, once you've implanted the TRT pellet in your body, you can't alter the dosing at all. And it's kind of difficult to, diffuse the concentration of the testosterone being released, right? So if we're microdosing you, and we're trying to gauge where you're best at, we can't really do much, right, with this guy. So if your blood levels indicate you need more or less, your doctor has to cut you open again to add or remove more pellets. Not so good. So, that's a lot to take in, right? So let's talk about basically the highest absorption method and the lowest side effect profile of TRT, so injectable testosterone. Okay, so based on clinical studies and our experience with most of the TRT methods of delivery, the single most effective form of TRT to optimize testosterone levels is via injection, right? So there are kind of, a few types of injectable testosterone formulations found on the market today. It's differences based on the weight of the ester, the injectable formulation is kind of different, in terms of how much bioavailable amounts are in mgs that are kind of, injected, right? And this chart kind of shows how much testosterone absorbed and used per each, mg of testosterone injectable. Okay, so let's get into some science now. Okay, so the length of testosterone ester determines how long your body takes to dispose of it, the hormone in question, right? So there are enzymes in the body called esterases, which are kind of responsible for removing the ester from the testosterone. Once the ester is removed, all that is left is the testosterone molecule itself, right? So the longer the ester clings to testosterone, the longer testosterone is active in the body, right? So if testosterone is active in the body for a longer period of time, a smaller amount of the overall testosterone dosage is absorbed, right? So now you kind of know better of how testosterone ester works. Let's talk about kind of the injectable testosterone formulations. So really popular testosterone prescribing physicians really work with these two, testosterone Cypionate and Enanthate. Many kind of physicians in North America, prescribe either Cypionate or Enanthate. This is for a few reasons. Cypionate and Enanthate have longer half-lives, allowing the user to kind of minimize the injection frequency. So for the guys who are like, hey, I hate these needles, it kind of can, reduce the amount of shots, taken. For better long-term adherence. The cost is more economical than other TRT products because they're made by compounding pharmacies, and they make them in bases that are more absorbable by my clients, right? So the bases they can make them in are grapeseed oil, cottonseed oil, and other types of oil bases that are kind of have a lower probability of allergies and lower probability of reactions, right? So, basically with regard to a weekly dosing of these guys, 200 mgs typically is, typically the normal dose, maximal dose, right? It's normally the maximal dose on a weekly basis, clinically, when measured over kind of a week. Cypionate and Enanthate both kind of have the same half-life or so. And so basically the advantage of using one Cypionate over Enanthate is basically patient specific, if depending on how, you react to it, and most likely they're very similar. If you are sensitive to benzobenzoate, that's kind of what Cypionate is mostly compounded in, then maybe Enanthate might be your best option, right? So that's that. All right, so something about TRT, it is heavily regulated by the FDA, but also the DEA, right? And so that's why if you get it, you really need to kind of have a qualified MD or physician that can kind of help optimize your health. So basically, if you live in a country or nation or a state that it is illegal to administer TRT without a doctor's prescription, then, going the UGL route or the self-administration route without a legitimate prescription is breaking the law, right? That's not the best way to go about it. A few things, because you don't really get a sense of basically your blood labs. You don't kind of get a sense of the peace of mind associated with working with somebody that's kind of actively looking at your biomarkers, your health, kind of monitoring you as you're going through this. If for example, if your hemoglobin pop up, right? Fancy words for your blood getting stickier, right? That could be some issues, right? Too much blood, getting sticky over too many years equals clots, and that's something we don't want to get into, right? And so as we think about it, the right dosing, beyond that, it is going to be an individual thing. And that's why it's helpful to have a doctor, right? To basically test your levels of, serum, testosterone, estrogen, and kind of make sure that your hormones are in line to make sure that you're getting the right balance, right? So, as we mentioned earlier, the highest range we've seen is around 200 mgs a week per se. And so the real balance, though, is dependent on you, though, right? And it's depending on kind of how you feel and kind of the optimal blood, hormone levels for you. And it's kind of making sure that we get you to that level so you feel great and you don't have side effects, right? So another way that we want to kind of, maximize the injectable testosterone is something we've talked about earlier. It is something called microdosing TRT. And we've mentioned this a few times before. We will recap it again. So what is microdosing TRT? It's basically not LSD. It is not using illicit substances. It's breaking the injections into smaller, more frequent injections in line with your body's endogenous production of TRT, of the testosterone, right? So what do we mean by that? So instead of taking injection once a month or once a week, it's kind of like redlining your endocrine system. It's almost like basically breaking your injections down at smaller, more frequent clip, right? To enhance the absorption and lower the side effects, right? Versus kind of flat 200, 250 mg once a week or 800, 1000 mg once a month, right? So our recommended protocols for TRT administration, a lot of our, former athletes are at, the 10 to 30 mg daily. This kind of provides the most stable, hormone levels, and it's easy to kind of go. It's easy to go, basically with regard to minimizing the aromatization, and mimicking the endogenous production of test, right? So what is aromatization? It's a fancy word, okay? When testosterone is converted into estrogen. Too much aromatization, and you get kind of those weird side effect profiles, gyno, man boobs, puffiness, and kind of the, the emotional issues. And last but not least, you may get something very rare called erythrocytosis, right? Another fancy word for what we talked about earlier, where your hematocrit and hemoglobin pop up and your blood thickens, right? So too much of that is not good. So, the next option is, Monday, Wednesday, Friday. It's kind of a compromise between, the daily and twice a week. And that is kind of the safe, the sweet spot in kind of how it all goes, right? Right. So with regard to that, I guess the third option 2 is twice weekly. But I think three times a week is what we recommend at a minimum, Monday, Wednesday, Friday. And, if that's not as comfortable and you want to go twice a week, that's totally fine as well. But really the best options are 1A and 1B. And it's kind of, something that's more of an individual thing and requires collaborating with your doctor to kind of really test your levels of test, right? Make sure that we can, establish and maintain a optimal hormone balance, right? All right, so good. So why don't we wrap this up then and summarize what we talked about today? So summarize it all. We started talking about the science behind TRT, kind of how bioidentical testosterone is structurally identical to pharma-grade testosterone and naturally structured produced testosterone. We spent some time kind of reviewing topical, transdermal, and intranasal, oral, and other delivery methods. Well, they work. Okay, they can work a little bit. Clinical studies and our experience have shown them to be far from optimal. So what does that mean? In other words, kind of the benefits don't really weigh the side effect profiles and the, the absorption challenges. And they're really inefficient if you think about kind of the injectable route. And so we gave you our kind of a recommended TRT protocol via kind of injectable and also microdosing, right? So microdosing, test Cyp or test Enanthate, that's kind of the best way to do it. And we also talked about kind of going through and optimizing your levels and balance with the doctor to make sure that you're kind of on this journey safely and effectively and you're constantly being monitored, okay? So that's all for today. And thank you so much for your time.